Good day, everyone. I'm Quinto John Francis, and together with me are RAYMUNDO Michelle, Sheilla Trajera Leal, SUELAN RG Christian, and TABUJARA John Dave are proud to present to you our topic, the relationship between maternal and child beliefs and practices in the utilization of prenatal services. To provide you a brief background of our study, it refers to how mothers' cultural beliefs and health-related behaviors during pregnancy may influence their decision to seek and regularly attend prenatal care. It also examines whether holding certain beliefs or engaging in specific practices is linked to how often prenatal care services are used, helping to understand what factors encourage or discourage mothers from accessing healthcare during pregnancy. So the study is aimed to determine the relationship between maternal and child beliefs and practices in utilization of prenatal services. The study aimed to explore whether there is a connection between what mothers believe about maternal and child health, the practices they follow during pregnancy, and how often they utilize prenatal services. In other words, it sought to find out if women who hold strong beliefs about maternal care or who actively engage in recommended pregnancy practices are more likely to attend prenatal checkups regularly. Understanding this relationship can help health providers design better programs by identifying what truly influences a mother's decision to seek prenatal care.
Methodology. This section outlines the methods used to explore the relationship between maternal child beliefs and prenatal care utilization. It details the research design, study sample, and research instrument. Research design. This study used a descriptive quantitative correlational research design to explore the relationship between maternal and child beliefs, practices, and the utilization of prenatal healthcare services. This approach helped describe real behaviors while also identifying patterns and connections between beliefs and the use of prenatal care. For the study sample, 44 pregnant mothers aged 19 to 45 from a selected community in Bacolod City were included through total enumeration sampling method. Inclusion criteria. Pregnant mothers aged 19 to 45 years old and an active utilizer of local healthcare services such as prenatal checkups, vaccinations, ultrasounds, delivery, and family planning. By including every qualified mother through total enumeration, it ensured findings reflected real experiences in the community. Research instrument. A researcher-made questionnaire was used that was validated by experts using the Loshi method with a content validity index of 1 and tested for reliability with a Combox alpha score of 0.878 indicating good internal consistency. The questionnaire was divided into two main sections. For the section 1, collected demographic data, the age, religion, income status, educational background. The second part is a pregnant mother's utilization to prenatal services. This helped to learn more about the background of the participants and how they use prenatal services. For the section 2, assess beliefs and practices using Likert scale. Beliefs were rated from strongly disagree to strongly agree, while practices were rated from never to always. This section had 10 questions about beliefs and 10 questions about practices to understand what mothers think and do during pregnancy. Using this scale made it easy to measure how much they agree with statements and how often they do certain practices related to prenatal utilization.
So for the result, this study examined the demographic characteristics, beliefs, and prenatal care behaviors of mothers, along with their utilization of prenatal services. In demographic profile, most mothers were aged 26 to 35 years, which is 45.5%, and Roman Catholic, which is 88.6%. Majority were from the lower income class, which has 86.4%, and had high school education, which is 47.7%. In prenatal service utilization, average frequency of prenatal visits was moderate, with a mean of 1.61. Older mothers are those in the middle income class showed slightly higher utilization. For maternal and child beliefs, beliefs were generally upheld across all demographic groups, with a mean of 4.14, which is interpreted as high. Highest belief scores observed in postgraduates and ages 26 to 35. Prenatal practices. Mothers often engage in healthy prenatal practices with a mean of 3.69, higher engagement seen in those with postgraduate education. Lastly, in statistical correlation, no significant relationship found between prenatal frequency and maternal child beliefs, prenatal frequency and practices, suggests that other factors, for example, like financial accessibility, may have a greater impact.
And for the conclusion, the results revealed that the majority of mothers were aged 26 to 35 years old, Roman Catholic, from lower income households, and mostly high school graduates. Prenatal care utilization was found to be moderate overall, with slightly higher frequencies among older mothers aged 36 to 45 years old and those from the middle class income group. In addition, mothers aged 26 to 35 years consistently reported a high level of maternal and child-related beliefs and practices, indicating strong adherence to health behaviors rooted from cultural beliefs and practices during pregnancy. However, in terms of relationship between prenatal frequency of recent pregnancy, maternal and child beliefs, and practices during pregnancy, no significant relationship was found between the frequency of prenatal visits and the extent of maternal and child beliefs or practices. This implies that, despite high levels of maternal and child beliefs and practices, these factors do not drive prenatal care utilization. These findings imply that factors like cultural, economic, and systemic factors such as affordability, accessibility, and community support may play a vital role in maternal healthcare behavior. Thus, to improve prenatal care utilization, it's important to have combined strategies that offer health education, respect cultural differences, provide financial support, and make healthcare services more accessible.
For the recommendations, first, it is to improve access to prenatal services. Local health authorities should implement practical strategies like barangay-based checkups, mobile clinics, and transportation assistance. Next, it is to dismantle barriers. The aim is to break down logistical and financial hurdles to ensure all mothers, especially in underserved communities, to receive vital prenatal monitoring. Next, it is for the culturally sensitive health education. Programs should be community focused, actively involving elders, traditional healers, and local leaders to integrate cultural practices with modern healthcare. Next, it is also to encourage family participation. Nurses should prioritize partner and family support in pregnant mothers' decisions, aligning with Filipino values like kapwa and bayanihan. Next, it is also to guide for the policymakers and professionals. Findings offers valuable insights for enhancing maternal health outcomes at the local level, considering both societal context and individual behaviors. And lastly, for future research. It broadens the studies to larger populations, explore additional factors, and consider a mixed methods approach for deeper insights into the prenatal utilization in the Philippines. And with that, we have reached the end of our presentation of our study entitled The Relationship Between Maternal and Child Beliefs and Practices in the Utilization of Prenatal Services. Thank you for all your time and attention. We wish you a blessed day.